Welcome to the committee, Representative Morrison. The chair moves House File 3450, and it is to be laid over for possible inclusion. So the bill is before us. Let's see, was there an amendment on this one? I don't think there is. So with that, I think, Representative Morrison, I think we're ready to have you present your bill. Welcome to the committee.
Thank you, Madam Chair. Madam Chair, members, thank you for the opportunity to present House File 3450, which is a bill to increase the Family Planning Special Projects Grant Program at the Minnesota Department of Health. FPSP programs provide pre-pregnancy and family planning services to low-income, high-risk individuals. The services that are provided include breast and cervical cancer screenings, contraception, HIV testing, and other STD testing and treatment. Additional funding is needed because clinics are struggling to meet demand. In addition to needs outpacing funding, some clinics have lost funding the last year due to changes to the Title X family planning program at the federal level. Title X also supports pre-pregnancy and family planning services. The need is real. Minnesota is experiencing historically high rates of certain STDs, and FPSP funding supports clinics in addressing these outbreaks. According to MDH, the rate of chlamydia in 2017 increased 4%, and gonorrhea increased by 28%. Family planning is important for health and well-being, and it saves money. According to the Guttmacher Institute, the services provided at publicly funded family planning centers save the federal and state governments an estimated $13.6 billion in 2010. I do have a testifier here today. Alyssa Light is the board president of the Reproductive Health Alliance to further explain the need for this bill.
All right, thank you very much. Welcome to the committee. Please give us your name and go ahead.
Thank you, Madam Chair. My name is Alyssa Light, and as Representative Morrison said, I'm the board president of the Reproductive Health Alliance and also executive director of Family Tree Clinic. Thank you. Chair and committee members. The Reproductive Health Alliance is a statewide coalition for the reproductive health safety net across Minnesota. RHA's membership includes a variety of leading healthcare organizations, independent nonprofit community clinics, federally qualified healthcare centers, and advocacy organizations. Our over 70 clinic locations provide vital healthcare services to tens of thousands of low-income or uninsured people across Minnesota. Our member clinics range in service areas from the west side of St. Paul to North Minneapolis, Cambridge, Duluth, Worthington, and more. Minnesota is a national leader in healthcare, yet many people across our state experience tremendous barriers to basic preventive healthcare, particularly reproductive healthcare. Things like contraception, STI testing and treatment, annual exams, and breast and cervical cancer screenings are increasingly hard to access for Minnesotans. The Family Planning Special Projects Grant Program is an absolutely critical funding source for Minnesotans across our state. Administered by the Minnesota Department of Health, FPSP was put in place by the legislature in 1978. And since that time, these grant funds have been used to support access to family planning services around the state. Funds available through this family planning grant program are specifically targeted at individuals who face barriers, primarily due to factors like poverty. Having access to family planning services improves the health and well-being of all people across our state and saves our state and federal government an average of $7 for every $1 invested. Minnesota's family planning clinics are staffed by doctors, nurse practitioners, and nurses with expertise in their communities. Clinics have gone unfunded and underfunded, particularly clinics in greater Minnesota and clinics located in primarily communities of color. With the most recent impacts to Title X funding, we're looking at an increasingly serious situation impacting many healthcare access points around the state. In fact, Minnesota is in the midst of an STD epidemic, and we have significant disparities in teen and unplanned pregnancy. Last week, one of our member clinics shared this story with me, and I wanted to share it with all of you. They saw a patient for her routine Pap and breast exam. It turned out she hadn't been to the doctor in over 10 years. She disclosed that she was experiencing intimate partner violence at home and that she was not safe to use her insurance. She had several health issues that needed to be addressed, and we were able to work with her, with case management staff, and with crisis response to help her get to a safe place after her visit. She trusted us because she said she felt seen, safe, and heard by the staff at our clinic. And she knew that this could be her moment to get support around the violence she was experiencing in her home. She also really needed medical care. And at the end of her visit, she said she felt like she was taking control of her life back. This kind of care is only possible with the Family Planning Special Projects Grant Program, period. We're reminded regularly right now that we are only as healthy as our most vulnerable community members. We have a powerful opportunity to do so much more with an investment in this healthcare need, in part because the infrastructure is already there, the programming is evidence-based and high-functioning, and the need is profound. We're grateful for the opportunity to request that you continue to say all Minnesotans' health and well-being is important and that no one should be left behind, and ask for your support of House File 3450. Thank you so much.
All right, thank you very much for your testimony. Is there anyone else in the audience who wishes to testify on the bill? All right, seeing none, and I don't have any questions here from members. Oh, yes, I do. Representative Halverson.
We're not going to have no questions. Actually, Madam Chair, thank you, Madam Chair. I don't have a question, but I wanted to elevate the story that was shared because I think it really underscores why we need to support family planning grants, and that is family planning care is really whole person care and really essential care. And I think that that story illustrates just how important and essential that it is for, if we want to really care for the whole person, we need to make sure that we are including family planning. And it's an area of healthcare that we put up far too many barriers for people, either shame or money or judgment, whatever it may be. And we're talking about whole person care. So that's all I needed to say. Thank you for sharing that story.
All right, thank you very much. Representative Grunhagen and then Bierman.
Oh, thank you, Madam Chair. Yeah, just in terms of, again, we want access for patients. We just had a presentation a while back here in this committee, and according to that study by economists that was hired by the state, 1.2 million Minnesotans in 2017 did not access the health care they needed because of the high cost. And we can point right back to Obamacare on that, okay? So I think that's more of the problem than doctors at hospitals wanting to give the care that they need. So I just wanted to point that out. There's lots of stories you could tell about people not getting the health care they need, okay?
Representative Bierman.
Thank you, Madam Chair. Thank you, Representative Morrison, for bringing this forward. There are a lot of stories that we can talk about where people aren't getting the health care they need, and that's the job of this committee, to begin to move the ball on that and to figure out what is going to work better. Someday, we're going to stop as our starting point of attacking Obamacare for all the problems of our healthcare system. And realize the fact that Obamacare did some really, really, really positive things. In fact, we heard about the positive side in this committee. And what we didn't do with Obamacare was have the follow-up that we needed. Expanding this type of coverage, as Ms. Light spoke about, the needs that are there for the basic care for the whole person and for women in particular, I hope everybody's going to vote for this, because that's the fundamental care. That's where it begins for the women and the mothers in our state of Minnesota. And my question is, if you would, what proportion of women in the state of Minnesota get the health care they need at this basic level of family planning?
Ms. White?
Madam Chair, thank you for that question. We know that currently, at the very least, 40% of women across our state are going without access to the care that they need, particularly when looking at family planning access and clinics that are dedicated to providing family planning, but not only family planning clinics, primary care, safety net as well.
Madam Chair, Ms. Light, thank you very much. So 40%, that's a big number. And we could make an impact right here, right now, today, to move healthcare forward for the state of Minnesota with cost savings. So thanks for bringing the bill forward, and I hope everybody will give this a yes vote.
Thank you, Representative Bierman. Representative Jordan.
Yes, thank you, Madam Chair. Thank you, Representative Morrison, for bringing this bill forward. I know that this bill has impacted people in this room because I was able to receive care when I turned 26 and was no longer able to use my parents' health insurance and had a gap in coverage. I was able to go to Family Tree Clinic, and Family Tree was able to work with me to take advantage of this grant to receive health care that I needed and receive screening for cervical cancer. So I, first of all, want to thank you for your work and thank you for expanding this so everyone can take advantage of programs like I did when I had this gap. And so my question is to that end, as we're talking about that gap in the ACA, can you talk a little bit more about how this program would help people like myself who are in transition from finding care and making these transitions in life? Because that's where I really do see a great need for family planning. You know, when you're making a big transition, you've lost your job, you've lost your health insurance. That wasn't a time where I wanted to have a child by any means when I was making those decisions. So can you talk a little bit about how this grant really could help, you know, young women like myself and a lot of people in my community access these grants?
Ms. Light? Or Representative Morrison?
Madam Chair, I just want to thank you, Representative, for sharing that personal story because it really helps to bring to light the importance of this program. And I'm going to let Ms. Light take the.
Ms. Light?
Madam Chair. Thank you, Representative Jordan. This grant program is intended to serve the need that you described exactly, as well as the need shared in this one story, which is just one of thousands of stories as to why someone might face barriers to family planning and basic primary care. Whether we expand health insurance coverage or utilize existing programs, there continue to be barriers to access, and these clinics are the front line for so many people to gain access and then also gain access to other services in these clinics like MNsure navigators or assistance through our public assistance programs.
Yeah, thank you. Thank you, Representative Jordan. Representative Keel?
Thank you, Madam Chair. I want to point out that this isn't the only service that happens in Minnesota. There are a lot of women's health centers that help these young mothers and families, sometimes young men that are in college or whatever they need, dealing with all kinds of issues that are health-related, sometimes connected to pregnancy, but they're just not a one-stop place. They are a place where they can go back and get the help they need, connect with the services they need, and help them to emotionally get through something that might be challenging for them, whether it's an unplanned pregnancy or other health issues. In fact, quite a bit of it is, from what I understand, is STDs from both young men and young women, or people in general that come in. But there are a lot of these services. I believe there is some state dollars that goes toward that, but mostly they are fundraised. They're huge fundraisers and work with these young people or in general and help families to become stable. There's fantastic stories out there about how there's been a crisis. But I want you to all know that it isn't just the government that does this. It isn't just the hospital and the clinic that does this. They direct them toward, there are doctors that run this. There's a lot of medical services, usually nurses are quite heavily involved. And it is a really good program, and I can't tell you the hundreds of people I've heard from that this is what's turned their life around, the support they've gotten, not just from that one visit or that one family planning session or whatever. So, thank you, Madam Chair.
Representative Morrison, did you want to?
Thank you, Madam Chair. Thank you for your comment, Representative. I guess I would just say we can't rely just on philanthropy to cover these gaps, and so I think it's important that we have this program.
Okay, Ms. Light?
Madam Chair, the majority of the clinics who make up Reproductive Health Alliance receive family planning special projects grant program funding. They also bill insurance and Medicaid programs, and they also all fundraise. And the only way that we maintain this safety net and keep our doors open is by having a robust business model that's taking advantage of multiple sources of support. So this program is critical, and the clinics that it funds are profoundly connected in their communities for the support that's there as well. Thank you.
All right, well, thank you very much. And I think we are, I don't see any other questions, and thank you very much. So actually, this bill is going to be laid over for possible inclusion. So we're not actually voting on it today, but perhaps we will be at some time soon. So with that, the bill is laid over for possible inclusion, and thank you very much for your presentation.